Good morning. Welcome to the Rotary Club of Hudson. My name is Marilyn Orr, President of the club, and we are thrilled to have you join us today. This meeting broadcast is available on HCTV, as well as our Rotary of Hudson YouTube channel and Facebook. Our club meets weekly using this digital platform, Zoom. When we meet in person, it's at Laurel Lake Retirement Community for breakfast. We hope to get back to that soon. We meet most Wednesday mornings from 7:15 to 8:30 a.m. So come out to join us for a meeting. We would love to have you as a guest. To learn more about Rotary, our club, and the impact we are having on our local community and the world, please visit our website, rotaryhudson.org. So enjoy this meeting today and help us share the message that Rotary opens doors of opportunity.
Recording is started.
Good morning, everyone.
Morning, Ron.
Members and guests, welcome to the Rotary Club of Hudson. I'm Ron Strobel, the Sergeant at Arms. Our invocation this morning is by Dan Williams.
Let us pray. Lord, in this time where there's so many things that are uncertain, we just need your help to accept change. As we look outside, we see the leaves change. We're reminded of the beauty of the world that you have created for us. As we look at a day like yesterday, with all the politics, whether it be at the local or the state or the federal level, a lot of change. And we would just ask that you would give your wisdom to those people who got elected, help them lead our country. Lord, the lives that have been changed by the virus, we don't know why all this is happening, but we do know that there's a significant effect on lives. And you don't have to go any further than our own Tom Page to realize that. And we ask you to be with his family as that changes. But amid all these changes, Lord, help us to remember that you're in control. As it says, all things work for good for those who love you, who are called according to your purpose. So even though we may be uncertain individually, remember that you are in control. For we ask this in Christ's name. Amen.
Amen. Thank you, Dan. And now it gives me great pleasure to welcome our newest Rotarian, Peter Spicagna, who will lead us in the pledge and four-way test this morning.
Thanks, Ron. Hello. Good morning, fellow Rotarians. I guess it sounds good to say that. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. And now we'll do the four-way test of the things we think, say, and do. Number one, is it the truth? Number two, is it fair to all concerned? Number three, will it build goodwill and better friendships? And lastly, number four, will it be beneficial to all concerned?
Thank you, Peter. And again, welcome to the club. It's good to have you. And now our president, Marilyn Orr.
Well, my goodness, it has been a very interesting 24 hours, and it's not all over yet. And I think I'm ready to take a nap this morning. I have had several conversations with Tom Page's wife, Dottie, recently, and she has asked that I share the following information with you. Tom's funeral is scheduled for November 21st at their church. Due to the safe distancing guidelines, her pastor has requested a maximum attendance of 40 at the funeral. And although she would love to have all Rotarians in attendance, it simply cannot be so. And so, this is like a wedding, she says. Invitations will be mailed so that no one will be turned away at the service. It's a very difficult time for Dottie and her family, but she wanted you all to know that because of Tom's devotion to Rotary, and in particular to this club, the Hudson Rotary Foundation will be a named charity suggested for memorial donations in his obituary and expected to be coming soon. On October 23rd, an art installation was begun by Suzanne Brennan Furstenberg in Washington, D.C., on the grounds of the Armory Parade Grounds. Small white flags were placed in memory of those who have died were lost to COVID-19. And yesterday, Tom's nephew and his family, who live in the DC area, placed a flag there in honor of Tom. The installation will be completed on Friday, November 6th, and it is anticipated that the field will be filled with more than 230,000 flags. This small gesture has been most meaningful to Dottie, and I'm sure you'll be hearing more about this in the news very soon. The sight of the field filled with white flags is very, very moving. She has asked me to share with you how important and comforting it has been to receive notes and cards from the members of our club. Okay, so let us keep her close. All right. As of right now, our speaker is not yet online. I'd sent her an email. I've received a response. So we're going to take up just a little bit of time to talk this morning a bit more about elections and how important elections are to our community. So as you can tell, we're punting just a little bit. My very first election was actually in 1972. At that time, I was a youngster, and the presidential election was between George McGovern from South Dakota and Richard Nixon. It was a very personal election for us because my father-in-law had attended Nebraska Wesleyan with George McGovern, and they were on the same debate team that actually traveled throughout the United States. Debating was a pretty big deal back then. My husband was in the ROTC at the University of Nebraska, and during that election, there was only one campus that Richard Nixon visited, and that was the University of Nebraska. It was a very tempestuous time, and the election ended up being one in which there wasn't, let's say, a Wednesday morning question of who was winning. And as we all know, in a couple of years, everything changed dramatically. So I'd like to invite someone else to share their first election. Can someone please unmute?
Well, I grew up in Chicago, suburbs. In Chicago, we follow elections like other people follow sports. And I came from a very involved family politically. My father was at Roosevelt's nominating convention when he was a teenager, and in his first, the first election, and then was off to World War II when he was elected again. So we discuss politics all the time. And actually, I believe the McGovern election was probably the first one I was involved with as a teenager. Little known fact about McGovern was, even though he's a peace candidate, he actually was a distinguished pilot, military pilot in the war. And a lot of people don't realize that. So I've been involved ever since in political campaigns, big and small. And, you win some, you lose some, as they say.
So James, that's where you learned to vote early and often?
Yes, exactly. Or, they say even those relatives who have passed away could still vote, at least in Chicago.
Okay, do we have anyone else with an election memory?
I tried to unmute, but
You are unmuted. You're now maybe you've muted back again. Mimi, you're still muted if you're talking.
yeah, okay. I was going to say my first election was a little earlier than yours. And this was coming out of a period of time when people really, I think, didn't pay much attention to politics as such, because we had been at war for quite a while. And so the first election that I voted in was the one that elected Dwight Eisenhower, for whom I voted at the time. And it was very interesting, based on what I've learned since, to look back and see how naive people were about the assumption that a national election was, very straightforward and easy. And this was in Minnesota at the time. So, and Minnesota politics, at least in those days, was pretty straightforward. I did spend some time living in Chicago, and they weren't anything like Chicago politics. So I think the thing that I remember most about that period of time was everybody was so upbeat and making assumptions about the fact that the future was unlimited. And I think today we have a different view of what our constraints are if we're going to have a future. And I think that's, just part of our reality. So,
Phil, could you unmute, please? I see Phil starting to talk. Phil? Okay. Does anyone have a memory of early elections?
Mine's not a very good one, but I have one. Can you hear me? Am I?
Sure. Yeah, John, we can hear, Joe, we can hear you.
Okay. So, the very first one that I remember, I don't know if it was the first one I was eligible to vote in or the first one I participated in, but it was somewhere around that. And it was the 1992 election. George H.W. Bush was running against Bill Clinton. Is that right? Yeah.
Yes.
Right. I also, and I'm not sure if it was actually that one or the midterm. I think it was that same one that I volunteered for the only campaign I've ever worked for, which was Mike DeWine for Senate. And I think this was his very first run for United States Senate. And so it was the only one I've ever done anything for. I went and put yard signs out and, maybe made some calls, that sort of stuff. So I sort of followed his career because DeWine lived just down the road from where I grew up in Springfield, Ohio. And he lives in a little town called Cedarville.
I know it well.
And, I'm not a partisan. I vote Republican, Democrat. I've voted for libertarians before. So I don't really have a dog in that fight or a horse in that race or whatever idiom you want to use. But I liked Mike DeWine, and I've ever since then been really proud that I did work for that campaign, and for him, he's in my view been a really good statesman, a great Buckeye.
There's one that I was. Oh, excuse me, Ron.
But Father Joe reminded me not of when I first voted, but a very interesting election in North Dakota in the 1980s. I'm not bragging now, but just to give you an indication, I was running the largest, next to the Bobcat Manufacturing Company, the largest manufacturer in the state of North Dakota. And I was very Republican, and my daughter babysat for the guy running for governor across the street from us, who was a Democrat. And so she, did her thing for his election. And when he threw his party for winning the campaign, my daughter got invited. I didn't. So that just goes to show you, what's important in life. It's not who you are, it's what you do.
I'd like to follow up on that story I was mentioned to. This is an old timer one, but this goes back to 1945. This isn't an election story, but it's a transition story from one president to another. And that was, my brother was in the Navy, or in the Army. He was a captain in the Army, and he was Transportation Corps, and he was on leave. We met him down at the Cleveland Athletic Club. I would have been probably 12 years old. And during that dinner, they announced that President Roosevelt died. And the question came up, well, who was going to take over? And somebody mentioned Truman. There was hardly anybody in the room. And there was a room of maybe 100 people that even knew anything about Truman. So it was just an unusual situation where you see a massive transfer of power and nobody knew who the successor was. And he was a great president, turned out to be a great president.
Liz Kowalik has indicated she has a story. Liz, can you share, please?
So this is very similar to Phil's, that it's kind of a transition story, but during the Kerry Bush election, so right after the election when Bush won, I was working and interning at the Fox News Bureau in Washington, D.C., and I had to interview Kerry. Again, this is post-loss, and I was with Fox News. So regardless to who you are on what side of the fence you lay, I don't care. But the story is pretty funny because we ended up being on time, which is when you're working with senators, they're never on time when you're on the Hill and you're doing interviews. 20 minutes late, completely normal. Once you get to 40 minutes, that's kind of pushing the media's luck. But so we're on time, and Kerry happened to be early. And he got really mad at us. I mean, I've never seen a grown man, like he was literally stomping his feet. And that was kind of one of those most pivotal moments to me about politics and politicians. And, my parents always told me that it doesn't matter who you are, whether you're the queen or you're the peasant, you should always be treated the same because we're all people. And it sort of just hit me like, wow, this grown man, I'm in college and this grown man is taking a temper tantrum in front of me. Needless to say, my next interview with him the next week, he was 2.5 hours late too and made me sit there. So I just thought it was really funny because it really made an impression on me on what we don't see when we're watching the news during elections and how you don't really know who you're voting for until you've actually physically met them. And again, doesn't matter who you are on what side of the fence. It's really interesting when you actually see the other side and you see that I had to pick sound bites that were 10 seconds long, 15 seconds long for everyone else to make decisions on. And you don't see that whole interview. You also don't see that when I was interviewing him, his PR specialist was behind him giving him hand gestures, 5, 3, 2, and she was trying to look at my, at the time, BlackBerry to see what my questions were so that she could help him know how to answer questions. So it was just really interesting seeing that side.
So Liz, I would love to see the archives of those interviews. I don't know if that's possible, but that would be cool to see, no doubt about it. I'm just going to jump in on the election. I don't have the election story other than, as that flag is over my left shoulder represents my father as a veteran. One of the reasons that I choose not to vote early or a mail, I like to show up and get in that line and feel that patriotism with others exercising their right to vote. And I got that same lump in my throat at 6 o'clock yesterday morning as I was standing in line in the dark and the cold, actually flew home from Florida to be able to get in line and place that vote, just because it meant that much to me, and that feeling, giving honor to those that have fought and sacrificed their lives for us to be able to exercise that right is my election story for today.
I have an election story. The son,
Here.
George Bush, and I was invited to go to one of his rallies by a neighbor of mine who worked in the political end of it. When we got there, it was really a rainy day. And the mayor of Cargo Falls, I think it was held at the Cargo Falls High School or something like that, and she prayed for a sunny day right there. And do you know what? It cleared up and he was able to speak. I thought that was amazing.
Well, we're getting close to wrapping these up. Our speaker is logged on. I have just one last story, and that is that I have long worked elections as a poll worker. It was I've done everything from working in churches here in Hudson to a garage, an outdoor garage in California. But my biggest experience working as a poll worker was actually at the Boston Township Hall, because they have honestly the worst chairs. Those chairs are designed for keeping meetings short. They are the folding wooden chairs. And at the very first break, I headed right back home to get one of my lounger chairs, folding chairs that I take to the soccer field so that I could last the remainder of the day. So our speaker is here, and I'd like to introduce my friend and fellow Rotarian, Dr. Genevieve Aguolu. Dr. Aguolu is the spouse of our own Chuck Nabufi. Genevieve is in the second year of a postdoctoral program with the Infectious Disease Internal Medicine Department of Yale, of the Yale School of Medicine at Yale University. Her program advisor is Dr. Saad Amir, a vaccinologist and an infectious disease epidemiologist, and the inaugural director of the Yale Institute for Global Health. As we've looked at COVID, both in the United States and as a worldwide disease, I think we all are realizing that a vaccine is most likely what we're all waiting for in order to get back to normal. And so we're going to invite Genevieve to unmute and take us away and give us more of an overview of what's going on right now and of her most recent research project. Genevieve.
Good morning, everyone. Thanks for having me. So my presentation is just to give a little bit of background on what's going on with the COVID-19 pandemic in the USA, and also to talk a little bit about my research. I'll start by just giving a little bit of data on COVID-19 since the pandemic started, and how it has affected our lives, and where we're going to go from here. So a little bit of background on infections. We all know that there are several microorganisms that cause infections: the bacteria, fungus, parasites, and virus. And for most of these microorganisms, we have specific medications that treat them. But for viruses, because they are not really classified as living things, it's difficult to really have medications that kill viruses. Most of the medications we have for viral illnesses either delay their growth or stop their replication. And which means that usually the solution to viral illnesses is to either find a vaccine or find ways to give palliative treatments, reduce symptoms until the patient's body is able to take care of the infection. So COVID-19 has the name because it's caused by a virus known as coronavirus. And it has the 19 because it was first discovered in 2019. when it started causing pneumonia illnesses among a group of individuals in Wuhan City in China in November 2019. The virus was later named SARS-CoV-2 because the structure of the vaccine looks like the same coronavirus that caused SARS in 2012. SARS stands for Severe Acute Respiratory Syndrome. Of course, COVID is coronavirus, and 2, because there was a SARS-CoV-1. So it is a new virus, and it caused an outbreak of a respiratory illness in a city called Wuhan in China. And it presents with high fever and pneumonia, which means inflammation of the lungs. So people who have it will develop shortness of the breath, cough, fever. And this infection spreads when people who are infected cough and release air droplets that contain the viral illnesses. So if somebody is within close proximity of an infected person and inhales the air droplets, or touches somewhere that the infected air droplets dropped on and wipes eyes or nose or mouth, that's how they can introduce the virus into themselves and become sick. And usually the more exposed we are to the virus, the more likely we are to get infected. So factors that increase the spread, of course, is when crowded situations, which predisposes us to inhale other people's air droplets, or having really close physical contact with somebody who is infected, or being in an enclosed space like cars in a place or rooms that are not properly ventilated with people who are infected. Also, duration of exposure is important. If you're around an infected person for a prolonged period of time, it increases the risk of getting infected. So in the US, as of the last data yesterday, we currently have over 9 million cases of SARS-CoV-2 infected individuals. And as of yesterday, there are about more than 230 deaths caused by or related to COVID-19. And the last 7 days, we've had almost 600,000 cases, which is an increase. It's been an increase over the last couple of weeks. 2 weeks ago, it was about 300 cases over 7 days. And the past 7 days, it increased to about 600,000. So it looks like the pandemic is not getting better. It's getting worse. And currently in the US, we have the highest number of COVID-19 cases worldwide, and we have the highest number of deaths worldwide, and not just because of our population. Even when you compare the proportion of people who are infected by population, we are still not doing very well in number of cases and number of deaths. When you compare the incidence rates for COVID-19, from this graph, you will notice, from this chart, you will notice that the number of new cases increase as age increases, and it seems to affect people who are 80 years and older more than any other age. And it actually also affects those 0 to 9 years old, just that it doesn't affect them as much as it affects the older population. Then when you look at rates of hospitalization, children can get hospitalized because of COVID-19, but the older we get, the more likely the probability of getting admitted or hospitalized because of COVID-19 increases, and it affects mostly the older population. As you can see, the age group older than 85 years old are more affected when it comes to hospitalization because of COVID-19. And this has been attributed to the immune status, and also as we get older, our body becomes more likely to get infected and more likely to suffer the consequences of infection. And also because as we get older, we're more likely to have chronic diseases, and the presence of chronic diseases increases the severity of COVID-19. Again, when you compare severity of COVID-19 based on death as a result of the disease or hospitalization as a result of the disease, you also find out that it's affected by age. The older we get, the more likely that we are likely. So in this picture, they're comparing every other age groups with people who are aged 18 to 29 years old. And those who are 0 to 4-year-olds are 4 times less likely to be hospitalized and 9 times less likely to die as a result of COVID-19 when compared to 18 to 29-year-olds. And of course, as you get older, it keeps increasing. And again, 85 years and older have remarkably higher chances of being hospitalized and remarkably higher chances of death as a result of COVID-19. Also, when you compare the COVID-19 cases by ethnicity, this is looking at number and not proportion of races. So again, when you look at the number, the white population has the highest number of cases, followed by the Hispanics and followed by the Black African American, Black non-Hispanic population. So this, for the purpose of this presentation, I only looked at numbers, but when you start looking at the proportion in each of this specific, race and ethnicity, it looks a little bit different. Again, when you look at death as well, the highest number of deaths is also among the white population, but then it changes for the Black population. They are more likely to die compared to the Hispanic, even though the Hispanics have the higher number of cases. And again, certain studies have looked at the reasons why this is so, and it's attributed to somehow the socioeconomic factors in that exist among races, and access to health and having health insurance. When you look at cases of COVID-19 by sex, it looks like females have higher cases, but then the males are more likely to die from COVID-19. COVID-19 has also affected Americans severely. A study by the Commonwealth Fund looked at some major developed countries, Australia, Canada, France, Germany, including USA, to study the economic consequence of COVID-19. And the study found that the US population were more likely to report that they were unable to pay for basic necessities like food, heat, or rent, and they have used up all or most of their savings or borrowed money, or even took out loan because of the pandemic. And this is compared to all other developed countries. And even with mental health consequences, the US has also been severely affected. According to the survey, the same survey by Commonwealth Fund, the Americans are more likely than people in other developed countries to report that they have mental health concerns. There were more adults in the US reported that they were experiencing stress, anxiety, or great sadness that was difficult to cope with alone since the outbreak of since the COVID-19 pandemic started. And unfortunately, we also reported that we are less likely to get needed mental health care during COVID-19 compared to other countries. This pandemic has significantly changed our ways of lives. We have had to stay away from our loved ones to reduce spread of infection. We have had to stop doing a lot of things that we love to do for fun or change to the way we do them because we are trying to reduce the spread of this infection. So the pictures that you're going to be looking at, we'll be looking at how this pandemic has changed our way of lives. So we have, you see pictures like this, you go to restaurants and you have waiters or waitresses wearing masks in order to be able to serve. We have older people in nursing homes not being able to spend time with their families. This year's Mother's Day, a lot of people had to do something like this just to see their loved ones, talk to them through barriers so that they don't spread infections to them. Even funerals have less friends and families having to visit because we're trying to maintain social distancing and people have to wear masks. Work has changed. For people like me, I have been working from home since March. It meant that I have to move back from Connecticut, and I've been in Ohio since March with my family, and turned my dining table to my office so that I can work. And the early part of the pandemic, my kids were working from home, so I had to be the teacher as well as the working mom at the same time. And it seems that we women, we are also seeing a bigger, especially the professional women, it's affecting us a lot as well because of this. Schools are beginning to go back physically, and you're going to see situations like this. Desks are moved apart so that the social distancing is maintained. In this picture, kids are not wearing masks, but in most schools, you're going to find, even in addition to the social distancing, kids have to wear masks throughout, except when they have to drink or eat. Beauty parlors are not left out. The clients and the staff have to wear masks and try to maintain social distancing, have less people in the shop so that it's not crowded to reduce spread of infection. In some areas in New York, you're going to find things like plastic pop-up space bubbles to reduce spread of infection. During the graduation season, we saw a lot of drive-through graduations or people who couldn't even attend their graduation just so to maintain social distancing. And this was during the elections. People have to spread out to listen and have the candidates have to have reduced rallies and town hall meetings as well. So also in churches are not left out. And other things you're going to see is disposable menus so that after each person uses them, they get disposed to reduce the spread of infection. Stadiums and concert halls, movie theaters have remained open. There are changes at the airports, less people are traveling, and you have to wear face masks every time you go out. So to reduce the spread of infection, we have to keep wearing the face mask because not everybody gets tested and not everybody who is infected knows that they're infected. So to protect others, and even to protect ourselves to an extent, we need to wear masks, keep maintaining social distance, keep washing our hands because we don't know where we're touching or whether where we're touching is infected. We have to keep cleaning and disinfecting our areas. The challenges in controlling this disease has been with the misinformation and with the myths that people are having. The challenges to mental health, people are having difficulties dealing with the isolation, the changes in their social life, and also the economic hardship of people losing their jobs and even their businesses as a result of this. This has made people not to be able to follow the preventative strategies that the health professionals have been releasing. So how can we make sure these lessons learned during the pandemic are remembered for centuries? Public scholarship, educate the public, let the scientists lead, don't assure people falsely, scientific and public awareness, keep investing in interdisciplinary scientists. These are my colleagues working with me at Yale. Opening up, the leadership has to continue with extensive testing and contact tracing to make sure that infected people are isolated, and reduce strategies to reduce household transmissions, and also keep researching for additional treatment options. Increase funding and better training of the scientific population. So these are the list of research that I'm currently working on. The first two the publications have already been released. We looked at the perceptions of the adult US population regarding the new coronavirus. It looks from our findings, older populations were more likely to have knowledge and to follow preventive behaviors compared to the younger population. And educational level was also associated with knowledge and with the likelihood of following the prevention strategies. The last three are still going on, and we're looking at the social mixing in workplaces and how we can use that social mixing to find strategies to help reduce the transmission of these infections in workplaces. We have one in the healthcare settings as well, where we're looking at healthcare workers and how their social mixing can influence the spread of infection. And we also have one going on in resource poor countries. There's Guatemala, Mozambique, India, and Pakistan. Those are the sites that we're also collecting data from. I'm sorry I had to rush through this. So much information to give. And I hope I was able to get the information across. Thank you.
Genevieve, can you take some questions from us?
Mm-hmm.
Okay, I have a question specifically about vaccines.
Mm-hmm.
In some of my reading, I have heard that there are 44 different vaccine trials going across the world. How will they decide which is the most viable vaccine to be utilized for our population as well as the world population?
So for all vaccine candidates, for every medication and including vaccines, there are trials and to make sure that they are safe and effective before they get released to the general public. And to determine their safety and effectiveness, they need to go through that 4 stages of trials. And it's based on the results of these trials that will determine which one that is most effective and the safest. So most of them are towards the final stages, and we're just going to keep looking at the results. And even when it becomes available to the public, it's going to still, it needs continuous monitoring to make sure that it's working and that it's safe for the public. So it all depends on the results of the trials.
Okay. Any ideas when these might be available for general public? I know that there's going to be a staged release, and that perhaps first responders, perhaps even our military, might have access to, vaccines first. Mm-hmm. Are you hearing anything about release to the public?
Like you mentioned, definitely there's going to be rationing based on essential workers, the healthcare professionals, and the older population. I believe the children and the pregnant women will be among the last group that will receive this vaccine. So it's going to start with people who are more likely to be affected, the people who are more likely to have severe illnesses or to die from these illnesses, and the people who are more likely to be exposed to these illnesses will probably be among the first people that would start to get these vaccines before it starts getting to the general population.
Thank you.
And they are still working on it.
I have a question. I had heard somewhere that the effectiveness of almost any vaccine is 50, 60%. Is that true? And if so, how will that really affect some sort of return to normal?
There have been vaccines that are more effective than that. For example, the HPV vaccine, the effectiveness is up to the 90%. So it all depends on which vaccine, and it all depends on the virus. For example, we have the flu vaccine, which we have to get every year, and also the effectiveness of vaccines depends on how many people who get it. The more people that get the vaccines, the more effective it's likely to be. Because when you look at it, if more people get the vaccines and more people become immune, then the spread of infection will reduce. So it depends on a lot of factors. The effectiveness of the vaccine depends on a lot of factors.
So some had suggested that we just let the virus run its course. People get sick and people die. Is that something that the scientists are recommending?
No. That is, first of all, it's not, from what I know in science, it's not feasible for that to happen. And I don't think that is, how do I put it? So herd immunity, that's what some people are touting that would help with this. Herd immunity happens when at least 80% of the population become immune. For 80% of the population to become immune, that means more than 80% suffer the illness. And this illness has about 3% mortality. Imagine the population of the US, which is about 300 and something million. And 80% of 300 and something million will have COVID-19 and 3% will die. 3% of 300 and something million. That's about how many millions? About 3 million, right? That means 3 million people dying. And we don't even know if that's gonna give us that herd immunity we're looking for. And those who survive, many people who have had COVID-19 and survived they continue to have consequences of these illnesses. They continue to have remnants. What's going to happen to this economy that we're trying to save? The hospital is going to be overwhelmed. Already physicians are suffering, healthcare workers are suffering because of how the hospitals are overrun and they see people dying. Where is that going to leave our economy, our healthcare facility, if we allow herd immunity to be our solution? So natural herd immunity has never been a solution to control of illnesses. We talk about acquired herd immunity, where you use vaccines to get people to be immune. So people are not sick. We're not getting people sick so that they can be immune. We're just stimulating their body to produce antibodies so they can fight this infection.
Genevieve, my question is, someone that has had the COVID, I hear stories about the fact that they'll be immune from now on. They can't spread it. That's part one of my question. Part two is, I hear also that people that go on venting in the hospitals, they die. And to avoid the venting. Let me hear your opinions here.
So your first comment was on immune after having the illness. We still don't know for sure. There have been cases of people who developed antibodies to COVID-19, and after some months, the antibodies start to go away. And there are people who have continued to maintain the antibodies. But from what we know about coronaviruses, most of them, the antibodies tend to go away. So we still don't know. We still don't know. We're going to keep monitoring. There's always a chance that the immunity is going to go away. There's always a chance that maybe it's going to stay. But from what we know about coronaviruses, immunity tends to go away. The coronavirus, the COVID-19 vaccine might become like the flu vaccine, where we have to get vaccinated during the season every year, so that has to keep happening. About the venting, most of the time, I believe that management for COVID-19 is getting better. Doctors are learning about this illness more. They're learning about these viruses more. Treatments are being discovered that help to people to survive more of these illnesses. In the initial time, most of the time, people don't know they have this illness. And by the time they get to the hospital, it might just be too late. So when you put them in the vent and they don't survive, they say vent makes them die. It necessarily doesn't mean it's the vent that is making them die. The possibility is that they probably got to the vent when it was already too late. So we're still going to keep learning about these diseases. This disease, we're still going to keep finding out things that we didn't know. The time is still too short to conclude on our knowledge on this disease. But what we know is that doctors are getting better in the management, and we're discovering better ways to keep people alive.
Is one of those ways the monoclonal antibody treatments that were given to Governor Christie and President Trump?
It definitely, the science behind it, it's definitely going to help if it's going to be available to a huge number of people, and depending on when people get it. The one treatment that a lot of my colleagues have talked about is the steroid shot, which how it works is it just helps, because what happens in COVID-19 is we get infected with a virus and our body tries to get rid of it. So that symptoms that we see is our body trying to get rid of the virus. So what the steroid does is to reduce our body's reaction to the virus, which is what actually kills us. So in this dexamethasone, this steroid is quite affordable and can be even obtained in low resource countries. So this is what is actually kind of making headway right now. The monoclonal antibodies, the availability, I'm not quite sure of that, but definitely the science behind it. It's because how it works is that when you give it to somebody who has the virus, it just kind of neutralizes the virus and prevents it from getting into the body and causing illness until the person finally gets rid of it. So yes.
Can you address plasma therapies? I have a niece who is the team leader of the blood bank and at one of the large Banner Health facilities in Arizona. And Banner has tested every employee in their health system for the presence of corona antibodies. Can you address that, please?
I'm sorry, what's the question, Marilyn?
The effectiveness of plasma donations of people who have already recovered from COVID? Are they still looking at that as being a viable treatment?
I haven't seen a lot of papers on that, but the idea behind that is also with the antibodies. So the plasma is where the proteins, that is the antibodies, are found. So the idea is if these antibodies can do the same thing that the monoclonal antibodies do to neutralize the virus in people who have it.
It's an old treatment.
Yes.
It's been around for a long
time. A lot of papers on COVID-19 on the use of that.
Well, it's also been used for many, many years, even before actually we had antibiotics.
Mm-hmm.
Yeah. Okay. Any other questions that we might have this morning?
I do have a question. I have a client who I'm pretty sure he started and sold 2 pharmaceutical companies down in Florida. And, you know, as he and I were talking about this antivirus, one of the things that he said is that there's just no way that he would, again, this is from a businessman, that there's just no way that he would have his family or friends or anyone he knows take any of this for maybe even 3 years until after it's been out because of how quickly it's being rushed to market. What is your opinion? I know, I mean, being married to a first responder, frontline person, she has to be able to go in the hospital and see her patients. So she doesn't have that choice. I do. All right. And so I'm just curious what your perspective is that if you weren't in the healthcare field, would you line your family up for this as soon as it comes out, or would you wait a long time before you did it?
Personally, I would, if I would accept this, I would look at the results from the trials. I would want to see the adverse effects. I would want to see the sample size, the population, the reports that have been done before I would accept it. So I wouldn't speak in general, because even though the other vaccines have taken longer in coming out, we know how the pandemic has affected the world population, and we know that technology has been improving over the years. So we can't really say, can't rule it out, the safety and effectiveness of this vaccine, because stronger technology has been developed since the last vaccine that we've had. So it's good to look at the numbers. It's good to look at the testings. It's good to look at how the testings were done, how the research was done before making the decision. So I wouldn't say for sure, and I wouldn't say rule it out completely. It's just to look at the numbers and to have faith that stronger technologies have been developed.
We have one more question from Mimi Becker.
Yes, I'm wondering, given the whole context of the discussion and your very well understood report, the CDC is currently pretty much muzzled. If the CDC, which has had global credibility with respect to epidemiology and also protection of public health, if they continue to be muzzled or sidelined, what is our option for moving forward safely?
Yeah, even us epidemiologists and physicians, we are stuck with that, and we're hoping that things will change, because it doesn't help the one institution that we've trusted, that have been able to get us through several pandemics, have been able to get us through several outbreaks, have gotten us to where we are today, and all of a sudden we're doubting its credibility. It is scary, and hopefully things will change for the better, because we should trust the scientists. They've done this for years. They have the knowledge. If you don't trust them, we can't depend on guesswork.
And with that, we're getting close to closing our meeting. Next week on November 11th, we'll have a tribute to veterans. We also will have a club general board meeting immediately following our club Zoom meeting, and all club members are invited to attend. This is a reminder that November is our fall scholarship donation drive, and it's currently underway. You should have received a flyer related to that with your dues, and we're hoping to wrap that up by the end of this month. You also will be receiving soon a strategic planning survey. The Strategic Planning Committee has been meeting diligently. We'll meet again this Friday, and we have a survey of our membership that's going to be reaching your emails very soon. Remember, we are a club of the members, by the members, and for the members. And so, in closing, I'm going to take a look back at this day in history. In 1847, Scottish obstetrician James Young Simpson discovers the anesthetic qualities of chloroform. In 1922, Howard Carter discovered the entry of the lost tomb of the pharaoh Tutankhamun. In 1924, Nellie T. Ross of Wyoming was elected America's first woman governor. Now, she was elected so that she could serve out the remaining term of her late husband, William B. Ross, but it wasn't long before women were winning that job on their own merits. In 1939, at the 40th National Automobile Show, the first air-conditioned car was introduced to the United States. And in 1979, Iranian militants seized the US Embassy in Tehran, took 63 American hostages. A total of 90 hostages were eventually taken. And the militants, mostly students, demanded that the United States send the former Shah back to Iran to stand trial. And many of the hostages were later released, but 52 were held for a total of 14 months and were not released until the inauguration day of Ronald Reagan. It looks like it's going to be a lovely day out today. I think I'm taking a nap though soon. With that, thank you very much. And thank you to Genevieve for joining us this morning. Okay, everyone can